Most of the babies start walking by the age of 18 months. Like there is a range between 9 months to 18 months. Most of the children we have seen walking. Some of the children start walking at a very early age of 9 months only. And some of them, there are certain causes because of which slightly they are delayed walkers. But after the age of 18, if your child is not taking a single step, is not able to put the weight on the weight of the body on the legs, then they should, meet their concerned pediatrician. See, most common reasons we have seen is prematurity. If your child is born before 37 completed weeks of gestation, or your child is born like a low birth weight baby, less than 2.5 kg, they tend to have a slight delay in their motor milestones, including walking. And the other causes can be congenital defects, like if you have a, hip dysplasia, discrepancy in the length of your two legs, or in case of some, after birth also, if your child required a lot of stay in ICU or had some prolonged illness before the child started walking, that also can cause slight delay in the walking. Apart from that, we have seen some, neurological conditions in which that affect the muscles of the legs of the body. Like in the case of birth asphyxia, if you are born with delayed crying, then you can have something called cerebral palsy, in which your muscles become very spastic, and in those children, walking gets delayed. Or if you have some muscular dystrophies, which affect the tone of your muscle, that also can cause delay in walking. Some chromosomal disorders like Down syndrome or Prader-Willi syndrome can cause delay in walking. And also, if nutritionally you are deprived of a lot of vitamins and minerals like vitamin D, calcium, which play a very important role in the growth of your bone and your muscles, that also can cause delayed walking. When the baby starts putting a step forward, then the weight of the baby is, taken by the muscles and the bones of the body. So if your tone of the muscle is not good, then it can cause slight difficulty to maintain the balance and the coordination of the body. So of course, weak muscles causes a delay in the walking. All the gross motor developments, the parents play a very important role. See, two things which parents can do is to improve the muscle tone of the child. Massage of the leg play a very important role. It not only increases the tone or power of the muscle, but also it helps to increase the flexibility of the body if you do a good massage of both the legs of the children. And the second thing is that the parents should give opportunity to the children to, pull themselves up. They should put the children on the floor so that it gives them an opportunity to crawl and to pull themselves with holding the furniture up. And they can give support to the child with the help of their fingers or with the help of their thumb. And when the child start walking, they can appreciate it by clapping or praising the child. And also, usually the parents, what they do is they get walkers for their child. So here is a note of cautiousness, that walkers should not be given to the children before they start putting their step forward. Because if we give walkers before that, then the child will learn toe walking. The child will not put the whole, their whole soul on the floor. And, walkers make them accessible to some hazardous place like switches and all that, and it can be dangerous. So instead of that, they should encourage the child to walk with the help of the strollers, which has to be done under the assistance of a parent only. And various exercises like rolling or baby gym and all that can also motivate them to, develop sitting or walking earlier. 18 months is the last cutoff we give. And after that also, if the child is not walking at all, then the parents should see their pediatrician. And of course, after the child starts walking also, in case the child is not walking in a straight line, that is, there is a difficulty of coordination, or there is a abnormal kind of a gait, slightly a broad based gait is normal in the child who learns to walk. But if there is some, putting one foot in a different way, or if there is a flat foot kind of a thing, then the parents should meet their pediatrician. There are some nutrients in our diet which are very important for the growth of your bones and the muscles. like vitamin D is very important, and the deficiency of it can lead to rickets. In rickets, what happen is that the whole growth of the body is delayed. Not only the child has a delayed walking, but also there is a general developmental delay in the child, and the growth retarded children are there, and also the other kind of minerals which helps in forming good bones and muscles is a calcium, phosphorus, magnesium. So if you are nutritionally lacking in all these things, then of course, and even proteins, your child can have delay in walking. First of all, it is very important to find the cause behind delayed walking. So, as I told you before, there are some diseases which can be responsible for that. And first, if those diseases are ruled out, and then the parents should be told that how the importance of vitamin D and calcium in the diet of the children. And in case we think that is lacking in the diet, then we supplement it with the help of some medicines, so that the child can have a good bone and good muscle structure. And in spite of that, if the child is having a delayed walking, then there are some physical therapies which are available and which helps the child to gain flexibility and balance and coordination. There are some orthotic devices also available, like walkers, strollers, and some rollers are also available nowadays, which can help the child. And some splints and braces are usually, given by the pediatric orthopedics doctors, which help the child to walk. And in case the child is having some neurological problem, like in cerebral palsy, when there is increased muscle spasticity, then there are some surgical corrections also done to relieve those spastic muscles, so that the child learns how to walk. Massage, as I told you, plays a very important role. So it increases the blood supply to the muscles and helps to improve the tone of the muscle. And in case your child is severely deformed with the behavioral abnormalities, because of which the child is not learning to any gross motor skills, maybe sitting, standing, walking, then that child require comprehensive therapies together, like occupational therapy, speech therapy, language therapy, and behavior analysis. And the child is taught to walk and gain all the other motor milestones. This thing is not proven. Only some of the studies say that if the parents are late walkers, then children also have slightly delay in walking. But more or less, it is eating habits, like I told you, the nutritional deficiencies. There are some congenital problems or genetic problems, and which come in your chromosomes from your parents, which can affect walking. Otherwise, we do not see a lot of role of the parents.